Supposed to have Q&A. Sorry, we forgot about it. We still have some time. So, is there anybody who want to ask Dr. Aaron or Keigo or even myself some question? If you want to ask some question, maybe you can open your camera or you can put it in the chat room. Well, we're moving very fast today. Dr. Aaron, what is your view on AFC super ratio in terms of the peptide? How would it help the body recover? Let's say if we have some chronic disease, how it's going to help people with diabetes or some vascular condition.
So first of all, I will always still say AFV products is not considered to be an actual treatment. Please don't stop your medication or treatment by your doctor just to take this product. But this product is actually very good in terms of the peptides that they use because it supports the body system for regeneration. So as mentioned just now in the slides, if you look at the blue one, SOP Subarashi, it contains certain peptides that can stimulate cell regeneration, increase the amount of blood circulation, and even reduce the high blood pressure. So when you do things like this, if you are, let's say, for example, you have high blood pressure, diabetes, and also cholesterol problems, if your condition is controlled by medication and you start taking this supplementation, the peptides, what happens is that the damaged blood vessels, the damaged cells in your body will start to regenerate. Your blood pressure will also drop because of the antihypertensive effect by some of the peptides. And once your blood vessels start circulating, you actually have a lot more of issues resolved. Some of you will know that in diabetes, you have numbness. If you increase the peripheral blood circulation, you reduce the numbness. Some of you know that the eye will have some damage when you are heavily diabetic. So by improving the blood vessel circulation and increasing the regeneration, you can actually improve this whole thing. So once you are improving, you are regenerating, as you follow up with your doctor, there is a very high possibility that your medications can be reduced. So most of the time when we start treatment, we understand that, oh, I'm starting it's lifelong. But imagine if a specific peptide can actually help you to reduce and even discontinue some of your medications. That will be the effect of the products and the peptides that they contain.
Okay, thank you. Thank you, Dr. Aaron. Joe has a question, right? Joe, please turn on your mic and we can take the question.
Yeah, Becky, thank you, Dr. Aaron, for a very clear explanation on peptide. My question to you is there an ideal time of the day to take these AFC products?
Theoretically, not really, but we can actually look into the function of peptides and try to formulate suitable timing to be taking them. For example, if we look at SOP Subarashi, the function of the peptides there are to control the blood pressure and to improve blood circulation and regeneration. So when you want something like this, you usually want it to be occurring in the morning. So we will be recommended to take it in the morning. If you look at Hikari, for example, Hikari focuses on improving the eyesight, regenerating the brain and the neurons. The time when the brain is most active and requires the most support is when you sleep. So theoretically, if you take Hikari at night before you sleep, the supplementation is the greatest. And of course, for Otsukushi, is more of a support. So immune system support and liver support and anti-cancer kind of support. So I suppose any time of the day would do. But perhaps maybe not together with, if you're deciding to take all three products, maybe you can take Utsukushi in the afternoon. But there's no hard and fast rule. I think it's more to whatever is most convenient for yourself.
So it's not
Yeah.
recommended to take all three at one time?
You can. Actually, in certain cases, in some testimonies that I have heard, because they want as much of the product that they can consume at one time, they actually take 3 sachets 3 times a day. There's no wrong or right in this. It's up to the individual, however much they would like to supplement themselves.
Thank you.
Right. So we still have Elise. Elise, please turn on your mic and we take a question from you.
Okay, hello, hi.
Hey.
Hi. I have question for each of our guest speakers. So first one is about nano. So when we talk about nano, does it mean that it's only applied to peptides? How about the other ingredients in each of the products? Are they also in nano size or just peptides?
Keigo, can you answer some of
Yeah.
this question? Yeah, but eventually I think we have to go back to the mother company, AFC Japan, to get all this detailed information.
Okay, all right. Yeah. Okay. The other question is a general question, but yeah, I don't know whether we need to go back to AFC in Japan, but I was always thinking, say we have salmon ovary, we have sardine meat for for the peptides, but do you have any idea how many peptides we can have in each of the ingredient? For example, the SOP, the salmon ovary peptide. So when we say, okay, we have salmon ovary peptide, but how many types of peptides are we looking at? Any rough idea? You know what I mean?
Maybe I'll take that. In answer to your first question with regarding nano and the other ingredients in AFC products, if we look at the other products that are included, like collagen, nucleic acids, and glutathiones and whatnot, these are actually all very similar to amino acids. And we know that amino acids is measured in the size of nano.
Oh,
So if the ingredients are very similar to amino acids, I presume very logically that they would also be nano-sized. There are, of course, a few exceptions, like in Utsukushi, they also add stevia. So stevia is a form of chemical, so it's not classified as a peptide. Yep. Okay, to your second question, correct me if I'm wrong. I understand it to be you want to know how much peptides are contained in one sachet. Is that right?
yes, or in each ingredient. So when we say the salmon ovary peptide, so that should not be only one peptide, right? There should be a lot of different combination of amino acids. So how many type of peptides would be there? I don't know whether it's a question that,
Yeah,
I put it in
I
the
understand. Okay. The answer to this can never be revealed because this is a trade secret. If everyone knew what type of peptides are contained, everyone would make their own peptides.
Yeah, okay. All right.
Yeah, but maybe I can share a little bit. My study into this marine placenta or salmon ovary peptides actually lead me to understand that just to produce one batch is about I think 10 kilograms. They use more than 2 tons of salmon. So it's actually a lot of fish product combined, compressed, and concised into just 1 to 10 kilograms of product. So actually, it's more to say that instead of trying to eat a lot of fish, since we know that it's coming from somewhere, instead of trying to eat a lot of fish, why not, if you can afford it, just take this product. It's not so much burden on the body.
Yeah.
And maybe the amount of peptides doesn't really matter, but the effect of the peptides that are confirmed are the ones that we should be focusing on.
Yeah.
Hope that answers your question.
Yeah. Thank you.
Okay,
Yeah.
I know Elise is from Australia, right?
Yes.
Can we
Yes.
take this opportunity to let you share your experience on using AFC product?
All right. I guess maybe, all right. Yeah. I guess
Yeah.
a lot of people might have watched my video. So it's just, I can tell you when I first met AFC, I really have no expectation. But because of Hikari, and I have glaucoma, I have high eye pressure, I have dry eyes, and on my right eyes, I think one of the optic nerve was damaged. So it's kind of reaching a point that my doctor say, well, you have to maybe, you have to have a surgery. So anyway, so when I saw Hikari, I said, wow, that's for me. So let me try. So I tried 3 weeks, and every day I just take I took 2 sachets a day. So after 3-4 weeks, when I returned to Australia, I have a another appointment with my doctor. And that appointment confirmed that my eye pressure was pretty much the lowest in the past 10 years. And then, yes, so she's happy with all the findings in that appointment, including say my dry eyes are better, my vision seems to be better as well. So now she's kind of like holding up the surgery. So I don't know, maybe next time we'll have to talk to her again and see whether I can, I think I still have to, just like Dr. Wong said, I'm still using the medicated eye drops to control the eye pressure. But hopefully maybe one day she said, oh, maybe you can reduce your eye drops or whatever. Yeah, so yeah, that was really good. Yeah. And yeah, and can I share one more thing? Because in the last 2 days,
Sure.
okay, in the last 2 days, it's funny. In the last 2 days, I have no, actually, I hurt I think on my right legs, around the knee area. I don't know what happened. I thought it was a muscle strain or ligament. I don't know. So it has been 3 weeks and it's not going. The pain isn't going. So I went to the doctor, and the doctor had a CT scan and also had a ultrasound. I'm still waiting for the result to come back, but the doctor said very likely my cartilages might have torn. So I might have not cartilage. Yeah, the what's that called? The cartilage. Yes, the cartilage tears. So she said it might be that. And if it is bad, I might have to do a surgery, because if the tears are bad, like shatter, like in the very small particles, then I might need a doctor to take out the shattered pieces. But I don't know. I'm still waiting for the CT scan, but the pain was pretty bad. I was thinking no. So because usually I'm still taking Hikari, but I'm not really regular on SOP and Usugushi. So in the last 4 days, I start taking 2 SOP, 2 Usugushi, and keep using my Hikari. Today is the 4th day, and today when I woke up, the pain is not there. I don't know. I'm still waiting for the result. I'm just telling you that it's just funny. It's just very powerful.
That's unbelievable, but
I don't know. So I'm still waiting for the result. But I was pretty good. I purposely used that for my pain, but I use it double. So double SOP, double Usugushi, mainly for the pain, because I know that's inflammation. Yeah.
Very good. Thank you for your sharing, Elise.
Thanks.
Yeah, so we have John here raising his hand. John, can you open your mic and we take the last question before we end the session, because it's already late. Hi, John.
Hi, good evening, This is John. It's good morning from me. I'm calling in from the United States.
Right.
Thanks for the excellent presentation. I had one question, and it's to do with the fact that we have a lot of people that when they take the SOP boxes, they see that you should like dissolve it in water and drink. And we sort of been advised to tell a lot of people to put it under the tongue instead of putting it in water. And I think one of the issues is that many people know that most of the supplements that we get here, the stomach acidity would sort of just render them like ineffective very, very fast. So my question is, one, are these AFC products really protected against all the stomach acidity so that they stay effective and they're absorbed? And the second one is, what should we tell them when they ask us why the box says dissolve and we're saying putting under the tongue? Maybe
Right,
Dr. Aaron can help me.
Right.
Aaron.
Yep. Thank you for your question. I do not know why the company prints the instructions to dissolve it on the box. But I can only infer that there's a possibility that not many people, especially those who are elderly, may be able to tolerate putting powder and keeping it for long periods of time under the tongue. So the easiest way to consume powder without choking is by dissolving it first in water and then drinking it. So to be the safest, because products will always recommend the safest on their labels to protect themselves, would probably be to just recommend that everyone mixes it with water and drink. But you are correct when you say that the stomach acid will destroy most of the products that we swallow, that we consume. That's called digestion. And yes, because the stomach acid breaks down proteins in the meats that we eat. So understanding that the AFC products are mainly peptides means that yes, if we swallow them, a lot of them are going to be rendered useless by the stomach acid. So ultimately, based on what Dr. Keigo has presented just now, seeing that the AFC products are in the form of Daltons, which are very, very, very small, it means that they can very easily pass through the membrane structures in the mouth and be very quickly absorbed into the bloodstream, as long as we don't swallow them. So for the best effect, I would say that the recommendation that we are giving, which is to put the product under the tongue and just let it dissolve there, would still be the best. Of course, that is only for those who are able to do it that way. If you find that you are choking because of that, if the powder is flying around, getting inhaled and causing you irritation, please mix it with water and swallow. One method that I could suggest based on this theory is that maybe after mixing the product with water, instead of immediately swallowing it, why not put a bit in the mouth, hold it for 2 minutes, then only swallow. So that would increase the amount of absorption through the mucous membranes on the mouth before swallowing it. Hope that answers your question.
Thank you very much.
All right. Okay. So I need to give some additional information. Okay. So because I'm more like to do some research again to mainly focus on my nano research. So I found that okay. So when you take this FC product, so it's better for you in the morning. So you consume a glass of warm water first. Why? Because you need to flush out, okay, all the dirt, okay, on the gut lining and the wall of your gut. So and then also it can give some expansion of your capillary. So when you consume this usukushi or whatever, so it's more but better absorption. Yeah, and the same also at night time also you drink just half glass of warm water, then only you consume. Then you will see, okay, maybe just in a week, then you can see very much different. So actually, it's to maximize the effect of this good product. Yeah.
Thank you, Keigo. I hope you have answered John's question, right? Right. So
Absolutely. Thank you very much.
so thank you everyone for joining our Zoom today. We hope everyone will have the chance to look at the our YouTube live streaming if your friend or you yourself want to revisit the Zoom session. Okay, so we have posted the YouTube link in the chat box. So please go ahead and watch it again. So we thank everyone for coming to join us tonight, and good night. See you next time. Good night. Good night. Bye bye.